Thank you, Godfrey. I appreciate it.
Yeah.
Okay, well, good morning, everybody. My name is Eric Coker. I'm calling in here from the United States. Just quickly about me, I'm an assistant professor here at the University of Florida, and I do epidemiology research looking at the health effects of air pollution, and I've done some work in Kampala. Um, uh, I'll be your co-chair for this panel today. It is a real pleasure and honor to be speaking to you today and on this panel on air pollution, urbanization, and health in Africa's cities. I wish I could be there in person with you all in Kampala. However, we all understand the circumstances. But I'm very grateful to the event organizers to enable this virtual event. And despite all the challenges of the COVID-19 pandemic, this panel has been 2 years in the making. So without further ado, please allow me to introduce this topic. It goes without saying that the public health challenges of air pollution are immense and growing more urgent in the context of climate change and population and economic growth in the continent of Africa. The public health and economic challenges from air pollution are truly systemic, multi-sectoral, and multidimensional, and requires multiple disciplines and approaches to tackle. The panelists here today come from wide-ranging backgrounds from public health, computer science, environmental chemistry, history, and international development. They will present their unique perspective and contributions to better understanding the challenges of air pollution, its impact on human health, and more importantly, solutions on how to address air pollution in Africa's cities. So please join me in welcoming our panelists today. We have esteemed colleagues, Dr. Engineer Beno Magisha, Dr. Lynn Atuyambe, Dr. William Avis, and Dr. Kenneth Aranatwe. First up today, we have Dr. Beno Mugisha, who is a professor and chair of the Department of Computer Science at Makerere University. He is enthusiastic about contributing to the quality of computer science education that is sufficient breadth and depth, practical and fast enough for Africa, for the continent of Africa. Engineer also leads a number of social impact projects and is co-founder of Sunbird AI, a nonprofit organization which develops scaled artificial intelligence systems for social impact in Africa. He is also the project lead of AirCo, Africa's leading air quality monitoring research and analytic network. He will present his topic, Advancing Air Quality Monitoring with Low-Cost Sensing Technology, the AirCo Experience. Dr. Beno Mugisha.
Yeah, thank you, Eric, for that introduction. So my name is Engineer Beno Mugisha from Makerere University. I chair the Department of Computer Science, where I also lead the AirCo project, which I'll be talking about today on the work that we've been doing in the air quality space. So my background is computer science. And for the past 6 years or so, I've been interested in seeing how we can leverage technology, specifically computational technology and tools, to help in the measurement of air quality, but also to drive insights in air quality data to inform decision making. So I will specifically talk about how air quality low-cost sensing technologies could be used to advance management of air pollution and reduction of air pollution in cities. So just a bit of motivation of why this is important. So air pollution is one of the key areas of the target areas of the SDG. SDG 11 specifically states that there's a target of by 2030, we need to substantially reduce the number of deaths and illnesses that are attributed to air and other pollution. And SDG 3 also states that by 2030, countries need to reduce the advanced per capita environmental impact of cities with a special attention to, air quality and waste management. Um, so how does, air quality management and measurement look like across the continent? So this picture here depicts a global view on, air quality monitoring across the world. And what we see here is that uh, when you look at the African continent specifically and many other low and middle income countries, you see that um, the activity in terms of monitoring is really limited. And if we really can't measure air pollution, then countries cannot be able to manage it. And this is a motivation for our work. We want to fill in these data gaps. And there's a reason why this is happening. One is that the traditional air quality monitoring relies on, reference grade monitors, which have high precision and accurate data, but they have some limitations that particularly are key barriers to adoption and large-scale deployment in low and middle-income countries. First is the setup, cost of a monitoring station is very expensive, and assume certain infrastructure requirements like constant power supply, stable internet connection, and also requires high specialized expertise to be able to maintain and operate. And this means that, we cannot have a wide coverage in terms of spatial distribution of these traditional monitors, as can be seen, for instance, on the African continent. And therefore, this is impractical to achieve, air quality monitoring that can give us the results to take decisions. So 5 years ago, at Makerere University Department of Computer Science, I started this work on how we can, leverage our understanding of the local context and the technology knowledge to develop alternative measurement technologies for air pollution. And we started with this innovation called AirCo, which provides alternative ways to measure particulate matter, which is one of the key indicators of air quality. Can run off solar or mains. So solar is important because we deploy to many places in our settings that don't have stable availability of power, or they don't have access at all to the mains electricity. And they're also able to transmit data over cellular communication, for instance, 2G, which we know that is predominant across the African countries. And we're able to measure other parameters like the location, temperature, humidity, and the others. And these devices are designed to be deployed either on static or mobile objects. And most importantly, also over time, we have modified this device to withstand the unique conditions that characterize African cities. Things like, when you have levels of dust, rain, which we found to be affecting most of the other available monitoring devices, because they are designed for settings that don't have this kind of unique conditions. So on top of the hardware design, we've also built custom software, which is meant to support the data that we get from the devices to build analytics that can inform decision makers. For instance, here what you see is an example dashboard that we have built, which is used by the Kampala Capital City Authority, which is the city government in Kampala. So they can be able to see and track the pollution across the different parts of the city. So each line here in the chart represents a location in the city, which corresponds to some administrative unit of Kampala city. And the line in the chart that has WAQG shows the target for World Health Organization is about 25 micrograms per cubic meter in terms of the targets that we need to achieve when it comes to air quality. So this kind of tools enable decision making for people who can implement actions that can reduce emissions in the cities. We've also enriched this with other tools like spatial temporal analysis, and also we built a platform that enables a city like Kampala to see how the different devices on the network are doing to enable easy maintenance and tracking. And here is an overview of the entire pipeline of our technology. So on the left there, on the lower side is a picture of one of our hardware engineers fabricating the device. In the center there shows one of the devices, air-core devices, deployed in one of the remote areas, which is has no access to electricity and therefore is powered by solar. And in the middle there, in the top side, what you see is the air-core device can also be deployed on a border or a motorbike, which are quite popular in many African cities, and allows us to track the pollution exposures for the passengers and the riders. And on the right is an example of a public-facing tool. It's like in the form of a mobile app that anyone can use to actually take decisions on when to go out and understand also the exposures in their neighborhoods. So low-cost air quality monitoring requires a constant calibration to improve accuracy. And as part of our network, we have a reference to grade monitor, which is a beta attenuation monitor that is considered as a grade reference, which we use to, we collocate with our low-cost monitors, and we apply machine learning methods to be able to calibrate our data to see that, we match the standard of the grade reference monitor at a significantly, small fraction of the cost that you would need for a grade reference monitor. And in the chart there, it's an example of how the air-core monitor tracks with the grade reference monitor, which costs, several thousands of dollars, much more than an air-core unit. And as you can see, they track quite very well in terms of the trends of the pollution. Thank you so much for listening. Just say, yeah, the air-core project's available on that website. You can also follow us on Twitter, and thanks to our different collaborators and partners who are supporting this project. Thank you.
Thank you, engineer. So we're going to switch to our next discussant. I do want to note to attendees that we are going to have questions and answers towards the end of this session. But if you do have questions at this point, you can feel free to put your questions in the Q&A, and we'll make sure to get to those questions and answers towards the end of our discussion. So Dr. Benamugisha, thank you very much for that really interesting talk on the important work that AirCo is doing. So I want to transition to our next speaker. We have Dr. William Addis, who has been working in East Africa on air quality issues for a while now. Dr. William Addis joins us from the University of Birmingham, and he is part of the Overseas Development Institute. He spent 4 years with ODI in various research roles, most recently with the Growth, Poverty, and Inequality teams. William's research interests include identity and conflict, globalization, and political voice. His PhD examined constructions of Asamese, identity in post-independence India. And Dr. Addis has been working in the space of air quality in East Africa and examining the role of vulnerable populations, and he'll be presenting on a systematic approach on how to deal with this challenge of air quality. Dr. Addis?
Excellent. Thank you so much, Eric, and thank you to Engineer for the excellent presentation. I'm delighted to join today's meeting and to provide a little overview of some of the work we're doing in East Africa. Today, I'm going to talk about a body of research undertaken by the University of Birmingham and partners that explored vulnerability to air pollution in East Africa. These studies explored the vulnerability of different populations, different occupations, and different locations in the cities of Nairobi, Kampala, and Addis. In this talk, I will also highlight a couple of potential initiatives that could address in a broad manner some of the causes or consequences of air pollution. Whilst it's broadly accepted that a significant number of deaths are associated with exposure to air pollution, both indoor and outdoor annually, and that these numbers are significant when compared to other leading causes of death, less is known about who is vulnerable and why. Indeed, whilst these headline figures are alarming, they tend to gloss over the disproportionate impact of poor air quality on certain populations, locations, and occupations. Our vulnerability scoping studies explore the experiences of these particularly vulnerable groups in East African cities exposed to high levels of both indoor and outdoor air pollution. Indeed, whilst air pollution is considered to impact on all, some groups are considered more vulnerable than others. This includes the young, the elderly, persons with underlying diseases, and groups exposed to other toxicants that impact with air pollutants, as well as those with low socioeconomic status. And in our studies, 3 dimensions of vulnerability are explored: exposure, i.e. the degree to which subjects or areas could be affected by air pollution; susceptibility, i.e. the likelihood of your being harmed by air pollution; and adaptive capacity, i.e. the ability to take actions to either reduce or avoid risk. In these studies, we collected air quality data via the deployment of low-cost sensors, and alongside this, we engaged with communities being studied via a range of qualitative measures. To aid analysis of air quality data in our study PM 2.5, data was categorized according to the US Air Quality Index. This index effectively traffic lights levels of air pollution from good, green, to hazardous, purple. So the first of the studies that I'm going to talk about explored the exposure of children in school settings in Nairobi to poor air quality. The length of time children spend in education is significant, 11 years globally, and children are in school for up to 220 days per year, and 8 to 10 hours of those days. Of this, only 2 to 3 hours is spent outdoors. Given the significant time spent in educational settings, it is key to understanding pollution in educational settings is key to understanding children's exposure. Children are also considered more susceptible to air pollution than other age groups, with exposure associated with cardiorespiratory effects, and also an emerging evidence base on the impacts of air pollution exposure on cognitive development. Air quality in and around urban schools is often poor, and various air pollutants are commonly found in classrooms, sometimes at elevated concentrations. In such environments, a number of factors affect air quality, including emissions from indoor sources, as well as the penetration of air pollutants from surrounding areas. There is, however, a paucity of evidence pertaining to air pollution exposure of school children in sub-Saharan Africa. To probe this issue further, air pollution was monitored in a Nairobi school on a school-based scale via the deployment of 2 air pollution monitors, one installed within the school grounds and one sensor located in a classroom, to garner a better understanding of the combined burden of air pollution exposure of students. To contextualize these findings, data was presented on the US Air Quality Index. The solid black line represents data collected from the outdoor sensor, and the dotted black line is the data from the classroom sensor. Data highlights that air pollution is closely linked, and that air pollution is at its worst during the morning period when children arrive at school. That air pollution is consistently bad throughout the day, with a slight decline in the evening. We also undertook a survey with students at the school studied to understand their perceptions of air pollution. And what we find is that school children are relatively cognizant of their exposure, that location influences perception of exposure, and that they are able to differentiate between air quality in different locations, acknowledging that poor air quality can be detrimental to health and is associated with school absence. This study culminated with an exploration of what actions could be taken by students, schools, or governments. In particular, this study highlighted the proactive steps taken by the school to address air pollution, those sources of air pollution under their control, including banning burning of waste on school grounds, adopting briquettes for school-based cooking, and establishing green infrastructure around the school. Other sources of air pollution beyond the school required more systemic change, i.e. vehicular emissions control and urban planning initiatives. The second study that I am going to talk quickly about explored air pollution at bus stations and on buses. And the rationale for this study was that Addis Ababa's population is forecast to grow rapidly, reaching 13.2 million by 2050, that vehicle ownership in the city is also expanding rapidly, with 137,000 vehicles added to the fleet between 2012 and 2016. With population and vehicle growth, Addis's roads are increasingly congested and mobility challenging. The majority of journeys made in Addis Ababa are currently made by public or non-motorized transport. And an opportunity exists to ensure that Addis's urban mobility future is based on public transport in a similar manner to Tokyo, and attempts to avoid the public-private vehicle dependency that is seen in other cities like Melbourne or Toronto. Exposure to air pollution in Addis is associated with a range of non-communicable diseases, and in Ethiopia, NCDs are estimated to account for 39% of all deaths, with cardiovascular diseases, cancers, chronic respiratory diseases, all exerting a significant death toll. Again, air pollution in buses and at bus stations, as with schools, is complex, related to both the nature of the vehicle fleet and of the urban geography and a range of other factors. In this study, a sensor was deployed at Addis Ababa Stadium bus station and on board Ambessa buses. Data from the air pollution sensor deployed at the bus station highlighted that air quality levels were consistently above background monitoring locations. Given the location of the bus station and the array of activities undertaken around Addis Ababa bus station, this is not surprising. What the data does highlight is that those who spend significant periods in this location are exposed to hazardous levels of air pollution. Air pollution data was also collected on buses and matched with GPS data, highlighting that exposure on bus transport was consistently at unhealthy levels. Histograms illustrate the period of time that users spent in different levels of air pollution, highlighting that daily commutes may be a period of particularly high exposure. This study allowed engagement with a range of occupations, street vendors and bus drivers, as well as commuters, to understand how they perceive vulnerability to air pollution, but also think through how poor air quality may impact on them. This study is of importance as it highlights that particular groups may be particularly vulnerable to air pollution due to their occupation or their daily commute. Again, the report highlighted a number of steps that can be taken at individual, organisational, and governmental levels. A focus of these recommendations is around the need to address in a systemic manner the causes and consequences of air pollution. This is developing broader solutions to urban mobility in rapidly urbanising cities. Finally, I would like to reflect on two areas of intervention that have potential to address some of the causes of air pollution in the rapidly urbanising cities of East Africa, but that require more analysis. The first is the potential benefit of shifting to e-vehicles. The direct and indirect implications of vehicular emissions on the environment and human health highlight that current transportation systems are unsustainable. Battery-operated vehicles produce less pollutants during use, though pollutants are produced during production and charging of e-vehicles. There is also an upsurge of innovation in and around e-vehicles. In Uganda, for example, organisations like BodaWorks, Zembo are producing e-Boda, the motorcycles you see below. However, the overall benefits of EVs depend on the following factors, with more studies needed to probe these issues: the type of EV, the source of energy generation and energy grid, driving conditions, charging patterns, availability of charging infrastructure, government policies, and climate of the region. The other intervention that may have some benefit for East African cities is that of plastic roads. In many contexts, the quality of road paving is particularly bad, and it is known that road paving contributes to air pollution in a number of ways, influencing the resuspension of dust, brake and tyre wear, and the energy needed by vehicles to move from one location to another. Efforts to better pave roads in a manner that could address waste, improve durability, and reduce costs could have a particular impact in East Africa. Indeed, research on plastic roads has shown combining plastics in asphalt can improve stability, strength, durability, and potentially reduce costs. Indeed, forthcoming research by the University of Birmingham is appraising the deployment of such roads in Ethiopia, and depending on the results, could be scaled up to other settings. Thank you, and over to you, Eric.
Awesome. Thank you very much, William. Incredibly interesting stuff. So let's go ahead and transition to our next topic. We have, unfortunately, we're supposed to have Professor Lynn Atuyambe give a talk today, but he's having some technical difficulties, apparently some type of bandwidth issues. But so we will go to our next speaker, Dr. Kenneth Aranatwe. Dr. Aranatwe is he holds a Doctor of Philosophy from Makerere University with specialization in environmental analytic chemistry. His doctoral research looked into profiling organic chemical contaminants in the atmospheric and aquatic environments of Lake Victoria. He teaches here at the Department of Chemistry at Makerere University. His research interests include prevalence and fate of organic chemical contaminants in the tropical environment, the dynamic relationship between climate change and environmental chemical pollution, emerging chemical contaminants in the environment and their effects on wildlife and human health. He is also the founding director of Circadu, as well as a Humboldtian George Foster Fellow at the Alexander von Humboldt Foundation. So I'll note that Dr. Aranatwe has been working in air quality in Kampala and the surrounding area for quite some time now, and so we're very fortunate to have him give a talk today. Dr. Aranatwe? Are you able to share your slides? Okay, great.
Yeah. Thank you very much, Eric, for the introduction, and thank you to the organizers for good work in organizing this and making it possible for me to participate in this way. I'll share part of a study that we have done between Tanzania and Uganda, specifically Mwanza and Kampala, and it was intended to explore the extent to which indoor air pollution can be reduced through...
Excuse me, Kenneth?
Yes, please.
Yeah, can you make your presentation full screen?
Oh, yes. Yeah. Sorry.
Thank you.
About that. Okay. Yeah, so the study intended to to establish the extent to which we can improve indoor air pollution, and we're mainly targeting peri-urban communities, which kind of have some informality to the settlement design and are characterized by compact households and also absence of kitchen areas or use of traditional cooking technologies, which are highly polluting. And so the two components were promotion of improved charcoal cook stoves, replacement of kerosene lights with the solar lights, and trying to see the extent to which this can improve air quality in the indoor environment. And the third component, which is what I'm going to share with you today, was to design a portable chimney that could be deployed in such households and then assess the extent to which this chimney could further improve indoor air quality. And so the picture I show here is part of Kampala, which is called Mbuya. And this is where we tested the stove. And a quick background about this nature of settlements. The households, most households lack kitchen areas that are separate, dedicated kitchen areas. It's not uncommon to find people cooking in the living areas. And the common energy sources are biomass, so charcoal and wood. And because of the pollution associated with the incomplete combustion of these, it's necessary then to find ways of reducing indoor exposure to these pollutants that arise from these fuels. And then also ventilation. Most of these houses are not really well ventilated. So trying to come up with a portable chimney is another way of trying to increase the ventilation in these households. And I just show some of these cooking technologies that we use. And this is not uncommon to find these in some of the households, because these communities have a wide range of socioeconomic levels. And we have this, but we can also have electricity and LPG in some households. And there are some efforts now to try to improve the conditions in the cooking areas by by the private sector production of improved cook stoves. And of course, solar technologies are proliferating in these communities as well. So in this study, we were interested in a chimney design that would be suited to these households. Normally, they are characterized by mobile tenants. So tenants tend to have high mobility. From a few years, they move houses and so on. So we're thinking, can we come up with a design that they can use, and if they choose to move, then take along and deploy wherever they go. And so we were looking at flexibility, affordability, and the technology needed to be user-friendly, and importantly, it needed to be effective in improving the air quality. So our objective was to design it, fabricate it, and test it within the community, and also then quantify the extent of the pollution. And to do this, in the wider study, we had asked about the willingness of people to adopt such a technology, and whether they would be willing also to have it tested in their households. And then we got volunteers whom we engaged right from the start of the design process and into the tests phases. So we designed this, and the first prototype was tested in the laboratory setting, and we were looking at 3 levels. So if I go to the structure again, it has a flexible tubing, which is a vent pipe that is flexible. It has a hood that is adjustable in height. And so in the lab tests, we are trying to see what is the optimum height that we can put this hood so that it is still conducive for the user without limiting the maneuverability of the user around the cooking area. And so in this, we did that test at 3 heights, and I will share with you the results of that shortly. And as I said, we randomly selected participant households from the group of willing participants, and we selected 5 households for participation in this test. And we are testing carbon monoxide and particulate matter, PM2.5, and we are also monitoring the usage of the stove. So we needed to relate the stove usage, the cooking events, and the pollution. And we're using real-time data monitors. And we did this over a 48-hour period. And for the lab tests, we did it for a shorter time. So in summary, in the lab tests, we tested, in the design here, we have 2 fans. The duct, the vent pipe has 2 fans that are solar powered. And so we tested one, each separately, and then also a configuration in which both were on. And so the results here show that. And what we see is that the red, which is carbon monoxide, was a better, it was responding more consistently than PM 2.5. And we came up with a height of 0.7 meters as the best hood, as the optimum height of the hood. And this is what we took to the community and tested in the 5 households. And what I show here is now the stove temperature profile for the participant households grouped together. So this is a group average for the 5 households. And it shows 2 major peak areas of indoor stove usage. And these also correspond mainly to the cooking times. And so as we went ahead, we were trying to see if this was going to be reflected in the carbon monoxide and PM2.5 profiles. And for carbon monoxide, so in the execution of the study, we did a baseline study. This is before deployment of the design of the prototype, and then we took those measurements over 48-hour period as well. The data here is compressed to 30-minute intervals over a 24-hour period, averaged over a 24-hour period. And what we see is that initially the baseline data is above the World Health Organization indoor exposure guideline for a 24-hour period. And then when we deployed the prototype, we deployed it, and then the users also made some recommendations on how to improve on the design. We did that, and then we came up with a second prototype. So the orange line shows the first prototype, and then the gray line shows the apparently improved prototype, which seems not to have performed better. But the improvement was actually to increase the flaps of the hood so that it's more flexible and adjustable, but that seemed to work against the performance. So but what we see is that the chimney was actually effective in reducing the pollution, indoor air pollution from baseline levels. So we also did that for the PM2.5, and the PM2.5 was all over the place. There were general, of course, the peak areas were consistent with the stove usage, but also in a critical analysis, you find that it's not correlated to the stove usage. The carbon monoxide was more correlated, but the PM2.5 was not. But the general high levels were consistent with the cooking times for those households. So this kind of indicated that in the general area, we are having peak emissions around that time, but they could not be entirely associated with the local indoor emissions. And so this kind of suggested that several outdoor influences in the indoor air quality with respect to the PM 2.5. But generally, the chimney was slightly effective, mainly in the night between 2 and 6 a.m. in the morning. Elsewhere, there was no significant observation of a reduction. So in general, the carbon monoxide concentration was reduced by about 55% from baseline levels for the first prototype, and the second one was less effective, reducing it to 40%. And then carbon monoxide, of course, was more, as I said, was more reliable in predicting or assessing the performance of the chimney. But there was a slight reduction on the overall PM 2.5 reduction by about 36% for the first prototype, and only 6% with the modifications. So what we can generally conclude is that the PM 2.5 in the indoor environment is not necessarily from combustion events in the indoor environment, but it seems there are other sources. And we didn't do a PM 2.5 characterization, which would have been more specific in source apportionment. But what we can see roughly here is that in order to address the indoor environment, it is necessary to also look critically at the outdoor environment within these settlements and beyond, so that a holistic approach to the indoor air pollution problem is in place. The dynamic exchange between the outdoor and indoor air movement needs to be considered when trying to advance strategies for improving indoor air quality. And going to the technology, I would say it was effective. It was effective, and its adoption is highly, of course, encouraged, but we still have to do further studies on lowering the cost of this, because the development phase of this, or the design of it, was not necessarily cost effective, but we're more concerned with the performance of it. And in the future, we hope to look more on the cost side of it. But with this, we would say the data that we have motivates an integrated outlook in the strategies necessary for reducing indoor air pollution. I thank you for this moment once again, and I wish to thank also to highlight that this study was supported by the International Science Council under the program of LIRA 2030 Africa, which is leading integrated research in Africa for Agenda 2030. And under this program, I was a grantee. Thank you very much for your attention.
Thank you, Dr. Arinatwe. That was really good stuff. I want to open up the session to question and answer. So I'm happy to take questions from the audience. See, we do have a question already in the chat. And it's directed, I believe, to Dr. Arinatwe, asking, would it not be more sustainable to incorporate an inbuilt chimney, which is not reliant on solar power, which the poorest homes may not afford? Any thoughts on that, Dr. Arinatwe?
Yes, thank you very much for the question. Definitely, that would be more helpful and more cost-effective in the long term. But this was being tailored to the nature of the settlements. Most of the tenants in these households do not have the rights or the power to make those structured adjustments to the houses that they rent. And so we were looking at a solution that they would use within that setting. And when they move houses and wherever they go, if there is no chimney that is inbuilt, then it would be helpful. It's not really a common thing that you see in Kampala or other areas around Uganda, that people are building houses with an indoor chimney. It's not there. What we see are ventilators or roofers, but that's it for the indoor for ventilation. So this was, given that some households cook in the indoor environment, there is a high emission of these pollutants. And you could see that from the presentation that the PM 2.5 levels in the indoor environment were, for example, higher than what William was presenting for the classroom environment outside. So having a portable chimney was something we saw that these tenants who are not property owners could use in their own setting.
Yeah, I think I want to also add, I think your study, and also, I mean, to some extent, Dr. Avis's, shows the complexity of Africa's cities in terms of dealing with air pollution. You know, you can have interventions at the household level which prove to be effective. So for instance, your study suggests effectiveness for carbon monoxide. On the flip side of that, we see for PM 2.5, you have the intrusion of outdoor air pollutants. So maybe Dr. Aronitwe, can you maybe suggest, what would you do if you were given a pot of money, let's say, to assess, you know, the degree, how would you go about assessing whether or not this hood is effective at the household cooking sources of particulate matter? How would you disentangle that? I think you mentioned something about source apportionment. What would you need to measure to be able to assess if at the household level we are seeing reductions versus what is coming from the outdoor environment? What would you measure?
Yeah, so what I would still look at those two, carbon monoxide, PM 2.5, and then I would also include chemicals like the nitrogen oxides and the, for example, the polycyclic aromatic hydrocarbons, which are products of fuel combustion, say from motor vehicles, and also maybe emissions from plastic waste. So it would be looking at what are the key sources of pollution in the atmospheric environment. And then when monitoring in the indoor environment, the immediate environment of the study households would also be monitored with sensors. For example, we could deploy air core sensors or any other sensors that have the capacity to, in real time, to monitor these other pollutants, so that we kind of do a multivariate analysis of these pollutants in the indoor and immediate outdoor environment, so that we can monitor the indoor-outdoor exchange of these pollutants. In our study, I had intended to study the PM 2.5 further to what I called the source apportionment studies, were to characterize this PM 2.5 to know where did it come from. But unfortunately, this is something I eventually got later in the course of the study, and turned out that I had used the wrong filters for trapping PM 2.5 because they had silicon in their formulation, and yet we needed silicon for monitoring sources of this PM 2.5. So we couldn't do that. But yeah, that in a nutshell, that's what I would be looking at.
Yeah, makes sense. Yeah, I mean, it's doing these types of measurements can be a little tricky. You got to have all the pieces in place. It sounds like you had an additional challenge due to the kind of the unexpected role of the outdoor environment. So we have a question for William from Barnabas Nawangi. Is public transportation the main source of pollution in Addis Ababa? Studies in Uganda have shown that the largest source of pollution is the use of biofuels for cooking. Can the results from Addis then be generalized for East Africa?
Yes and no. So in terms of Addis's vehicle fleet, there is a large number of older, very polluting vehicles. I think in terms of kind of vehicle standards, they're relatively lightly enforced, if not absent in complete. So, I mean, buses in Addis Ababa are particularly polluting, but they won't be the only sources. There's a large number of taxis and other vehicles, matatus, for example, that ply the roads. So I think there's a kind of a collection of sources of pollution that lead to the particularly high levels of air pollution found on Addis Ababa Street. I think also one of the factors that influences pollution in Addis is the geographic location. You know, I think each context, climatic and geographic conditions will influence the levels of air pollution. One of engineers' colleagues, Paul Green, did some really interesting work thinking about the nature of Kampala and how the geography influences levels of air pollution within that setting, particularly the kind of valley location trapping in air pollutants. So I think each, and this kind of speaks to Kenneth's point about kind of contextually appropriate solutions, that whilst kind of drawing on the increasing evidence base about what works in tackling air pollution, really kind of tailoring it to the specific connection. I think one of the things that each of the studies has highlighted, and the point that you made, is about the complexity of addressing air pollution, the kind of risk of unintended consequences of initiatives. You know, efforts to address air pollution in one setting or one location might shift it to another location, and so one needs to think of a more holistic approach to the issue. So I'd always kind of caution against generalizability of findings, but suggest that looking at interventions that have been trialed in one setting and how they could be tailored or rendered context specific in another location is certainly somewhere to start. And I think there is a growing evidence base from cities such as Mexico, locations such as London, that can be tested, analysed, appraised to see what worked or what didn't work. Birmingham, for example, has just initiated a clean air zone in the city centre, and that's kind of had some kind of pushback from the residents of the city. So I think these are kind of things that could be learned from when tailoring interventions.
Thank you, Dr. Avis. I saw Dr. Chirenga, you had your hand up. Did you have a question?
I wanted to make a comment, but I see Lynn is here. I don't know whether he will have enough time to make his presentation. But thank you very much, Eric, for chairing this session and for the presentation. I will make it super brief. I think for Kenneth, we need to look at the process of combustion and how PM is generated and what goes where. You may actually find that the chimney would have worked better because the particles, they tend to smolder around the fire and they disperse more before they go up. So maybe understanding the process of combustion and what is generated at each stage can improve this very important project. Thank you.
Kenneth, did you want to respond to Bruce's comment?
Yeah, Bruce, thanks for that comment. Yes, I agree with you, and to some extent we tried to minimize that by incorporating these solar-powered fans in the vent pipe or in the exhaust pipe, trying to use them to kind of do evacuation of these emissions around the source of the emissions, which is the cooking area. But I agree with you. Yes, it needs further assessment for sure. Thank you.
Eric, you're on mute.
Okay, you're mute.
Thank you, engineer. Yeah, no, I was just, I just wanted to mention that Dr. Atuyambe, as Bruce had mentioned, is now on the line. Atuyambe, did you want to take some time to briefly go over your presentation so that people can learn about the work?
Thank you very much. I don't know how many minutes I can be allowed. I can maybe present one graph, and even if it's 2 minutes, I can just do that.
Let me make a quick comment. I think you can give a brief background just of the GeoHub and then the main findings. I think they're really compelling findings, and I think it's important for people to learn about it. So I think we can say if you can go 5 to 7 minutes, I think that's fine. And in the meantime, people can still put questions in the chat, as we have a question from Asasira Ignatius, and Kenneth, if you could respond in the chat to that question, that would be helpful.
Thank you.
All right, thank you, Atuyambe. You have the floor.
So thank you very much for giving me this rare opportunity after failing with this technology. But I would like to quickly say that my topic was on the effect of COVID-19 lockdown on air quality in Kampala, and this is the experience that we have at the GeoHealth Hub. And my name is Lina Tuyambe. This was the overview, but maybe just highlight the partners. This is the work that we are doing. We have several investigators. In Uganda, we have myself, Professor William Bazeyo, Samuel Etajak, Agnes, Felix, and Simon. But from the US side, we have Professor Kiros from Colombia. We have Professor Samet, we have Abera from Addis. We have Heather, we have Christine, Jonathan, as well as people from Nairobi and Rwanda. So that's the layup, and these are the partner universities. Just to say that we have been championing this in the last maybe 7 years, and the research aims for our project is to look at the air pollution and population health. And we looked at we have the continuous central site monitoring, which is in Mulago at the School of Public Health. And we also have a time series study where we collect hospital data from 6 hospitals in Kampala. The other component was the air pollution and children's health. And here we did exposure assessments in 10 schools in Kampala. And then the third component is the occupational health and climate change. This was affected badly by COVID-19, so we actually haven't started. We're supposed to have started, I think, last year in March, and we have not yet started. We hope that we shall start soon. I will quickly jump this because I'm sure participants, you are all interested, and therefore you are familiar with this information. But maybe just to say that air pollution is a big problem in Uganda as we speak. And in one of the days, I was just driving to office, and I was just amazed by how the visibility was being affected. So we look at the health effect, but also there are other what I call bonus problems that we get, including accidents, because of visibility and because of the jitteriness of the drivers. So let me just show you the findings of what we found. So we have data from 2018 we looked at data up to 2020. And as we can see from 2018, we have the monthly averages concentration. It was here going down, going down. This is the normal pattern, but you see it is still very high, up to 30. So that's 2018. And in 2019, which is the orange graph, line graph, this is what we're monitoring using BAM. We use the BAM 1022, and the pattern is clearly the same. But during the lockdown, which is the green, we realized that the pattern is the same, but it went further down up to the most healthy, air to breathe. And it started going up slightly as the eased lockdown. So you can clearly see that controlling, especially vehicle-related pollution as an issue is very important. And this is some of the information. As you can see, during the COVID-19 lockdown, there was significant reduction of air pollution in March and April, as indicated by the PM 2.5 levels. But then we also observed that there was a slight gradual increase in May, June, and I'm sure as we opened up the transport and other systems, the factories, it went almost normal pattern. And so that is the information, and went as low during the COVID time. The lowest point was actually 7 micrograms per cubic meter. When we did averages, hourly 24-hourly averages from PM25 concentrations, you can clearly again the evidence that for the years 2018, 2019, it was the normal pattern, but it was still, you can see this line. But when it came to during lockdown, indeed, it went low from, you can see from March, April, May. And we can also see the different hours. You can see around 9 o'clock is the peak, and around late in the night, I think around 10:30, 11:30, and the pattern is the same. Interestingly, that's the time when the vehicles are moving. During the 9 o'clock, the traffic is just too much. And later on, I think the effect of atmospheric temperature, at night, it again becomes thick, starts settling down with the temperature going down. Yes, so that's what I just explained already. Between around 9 o'clock and 23 hours, those are the peaks. And therefore, if you are planning to be jogging at night or jogging at 9, be very careful. This is just illustration of what it was before and the congestion to the left. And this is during the lockdown of last year. The air was very clean, and the policymakers need to take careful look at this and see what can be avoided, and we do some infrastructural and policy shifts to make sure that we improve. A quick conclusion that results consistently show a remarkable reduction in air pollution in Kampala city, the late March, April, and May, and a bit of June. And this coincided indeed with the lockdown and the gradual opening up last year. And we also observe that during the working days, indeed it is higher in the morning, early morning at 9, and also late in the night. So our results really suggest strongly that motorable transportation significantly contributes to air pollution in my city, Kampala. And some implications, we could deduce more, but we think we could, that traffic police should routinely inspect the quality of vehicles on the road, and enforcement officers should check whether a vehicle or motorcycle is fully serviced, and including the status of the vehicle. There was an attempt some years back with SGS, it headed nowhere. And perhaps we could innovate and have some perhaps cheap ways of monitoring emissions. That's something that we could observe, and so that cars which are not worthy on the road should actually not go on the road because they are poisoning us. Yeah, so I want to thank you for giving me this extra opportunity, and this was the grant, and these are some of the pictures. This is Jonathan Simon, this is Kiros, this is somebody from Rwanda, and myself, this is the OBAM, and this is our office, and we had actually the NIH officer visiting us. Thank you so much, and thanks again. Thank you, Chair, for being very supportive, and everybody. I thank you. Over.
Yeah, it looks like Eric maybe dropped off. Thank you, Prof. Alin Jambi, for that interesting presentation and insights. I think we don't have any questions in the chat. But yeah, anyone with a question, I think we could take a few questions before we come to the end. Thank you.
Eric, in the chat, there is a comment from Flavia.
Okay. Yes, so the question from just a moment. Could you read that out, Kenneth? Is directed at who?
Yeah, it's directed to Dr. Tiambe. This is from Flavia Nasaka. It says, Dr. Tiambe would be interested in knowing what is happening now with this partial lockdown. How would now compare with the results you saw in last year's lockdown?
Great, thanks, Lynn.
Yeah, well, thank you very much for for that important question. We actually considered up to then, but this lockdown has just started. We are monitoring from the data now. I can't present it, but from what I see, it was again starting to go down. But it's just 2-3 weeks ago in this month that the lockdown started. I guess I will present more evidence, because now we have an opportunity for June, July, and August. So the pattern will be clearly when we add those months, because we just did 6 months. We compressed 6 months for visibility. But now that this lockdown started in June, then we shall have that good opportunity to even bring more comparing evidence. Thank you for the question.
Thanks. I think Eric is back. Eric, I hand over to you.
Yes, my computer crashed, so I had to reboot my computer. But I'm also showing you a graph here. We just published a paper with Dr. Benamogisha using the ERCO sensors. I don't know if you can see my screen here, but can people see my screen?
Yes.
Yeah.
Okay. We had the exact same finding using the ERCO sensors. That indeed, so this is a graph of 2020, and the ERCO sensor saw the exact same thing, a steep decline in particulate matter, 2.5 in April, all the way down to around the World Health Organization limit, and then a steady increase as the lockdown got opened up, as the country opened up. So I think Dr. Atiyambe's findings are really quite credible, and so I would suspect the ERCO sensors are probably detecting something similar right now. But just to add on to that finding, so we are coming up on our time. And I don't know if there's any last minute questions or comments. I did have a question that I'm hoping maybe the panelists can try to address. The vulnerable populations, there's a lot of low-income people that are impacted by air pollution in particular. And I wonder if anybody wants to comment on how we can better target interventions for these low-income populations, maybe through use of information communication technologies. Do anybody see any promising opportunities there?
Yeah, Eric, I can make a comment on that in the work we are doing at EACO. So the development of low-cost sensors gives us an advantage that we can deploy a high-density network of monitoring. And we're putting these in the communities that are affected by air pollution. And that we are doing is developing digital platforms that can allow engagement with the community members. So for instance, if a community member observes a pollution event, let's say burning rubbish, they could feedback this information to the platform. And by doing that, they are aware of the causes of the pollution in the environment, which of course is validated by the monitors that are within their communities. And what we see is that air pollution is highly localized. You can have high pollution in one place, and a few kilometers away you have better air quality. Just a quick comment, also being aware that we are out of time. Thank you.
And maybe, Eric, I could add, this is the Lina Tiambe School of Public Health. We are competing again with the NIH for additional funds. And as I didn't maybe talk about it, we visited 10 schools, 2 per sub-city, 2 per division. And we followed up these school children from different schools, Buganda Road and whatever, into their homes, and they come from all over Kampala. And in case we get funding for this funding opportunity from the NIH funding the GeoHealth hubs, it means that we are able now to have the socioeconomic status of the different household members, and we are able to have much more information about the effects of the air pollution in these highly densely populated in Molago, in Kawempe, in Queen of Peace, in Ruwaga, different places. So we hope that we can get funding and then we can continue this work for the next 10 years. Thank you.
And I was just going to add a positive note to conclude, perhaps, that innovation is happening everywhere. I think what is needed is more efforts like EACO are undertaking to empower individuals with the information they need to address this issue. I mean, I was part of an event with EACO in Namawongo, where one of the participants was creating briquettes from household waste as an alternative to more polluting fuels. So I think empowering individuals with the information needed to really innovate and generate home-based solutions is key.
Eric, I have one quick question, and it may not be answered right now, but it's directed mainly to engineer and the lean. So in the data you showing low pollution in the lockdown phase, so yes, can be largely attributed to traffic reduction. But in your assessment, have you tried to look into whether this is associated with reduced emissions from the vehicles or reduced vaporization of dust that is associated with vehicle traffic? Because we know most of our roads are not paved around the city, and even the paved ones are not protected from earth coming directly onto the paved surface. And so like in after rainfall events, we get a lot of dust. So your PM signal, do you know whether it can be associated with vehicular emissions, exhaust fumes, or is it dust particles being raised by the vehicle?
Maybe I can make a quick comment and then engineer will supplement. Obviously, from the graph and the extent of our data, even looking at the pattern of the data, because we also had e-sampler data, which was also deployed before, we could see that these are mainly vehicles, but also we have the opportunity to analyze further. We have all these filters that we collected. We don't yet have the technology in Uganda to analyze the attribution of the different types of pollution or pollutants within the PM, but we have agreed with Colorado University to do the analysis, and perhaps we should get back to you in the near future to give you exactly what it was. But so maybe engineer, you can get on board.
Yeah, thanks, Prof. Lin and Dr. Kenneth for that question. Yeah, I think we have to say that we have multiple sources of PM 2.5 in Kampala. Of course, vehicles is one, vehicle emissions is one. We have the dust, we have, biomass. So the lockdown, led to a reduction of many of these activities, even things like roadside cooking, for instance, that was also impacted upon. Of course, the vehicles were impacted upon. Even the restaurants in town, were not, operating at the normal capacity. So I think it's a combination of factors, but obviously, to get a concrete answer to that, we'll have to do a source apportionment study, which I know that Dr. Ariniti, as someone from the chemistry background, you could give more insights into that and how we can undertake that source apportionment, actually understand the composition and the contributors of the PM during that time. Thank you.
Thank you. Yeah.
Great, thank you. So I think we can close our session. And so I do want to thank our panelists and our attendees and the conference organizers. This is obviously not the most optimal environment to do these types of events because of the pandemic and the country is on lockdown. But I just give everybody a lot of credit for trying their best to really put together a really compelling presentations and overall conference. So just a round of applause and thank you to everybody who contributed. I do look forward to the solutions to dealing with Africa's air quality issues. I think Kampala is kind of a breeding ground for innovative ways to understand the problem and solutions to the problem, and hopefully this information can filter outward, and I'm very confident that it will. And finally, I just want to say I pray and hope that everybody stays safe and healthy, and just again, thank you very much for all your efforts.